So this toolkit was developed by our campaign integration working group with our office. It's a beta version is up on our website, and it definitely will go through iterations and improvements. And so we welcome feedback from any and all folks who work on campaigns and who've had experience with integrating them. And we're just soon about to put up the French and Spanish versions. We're also entering a new phase where we're working with the consultancy Linksbridge to turn it into a digital, like online interactive toolkit with more functionality. So we're excited about understanding more country and global users' needs to help inform the sort of that next phase. But for right now, it's a PDF or Word version, and so we're happy to share it. And the purpose is to assist officials and stakeholders at the country and global levels to identify, collect, and consider information on the potential opportunities for health campaign integration. So objectives are to identify opportunities to initiate discussions, to provide some evidence-based criteria on which to have those initial discussions, to highlight potential barriers or facilitators, and also to highlight the country context that should be taken into consideration, and to facilitate the synthesis of some global and national guidelines and standards. So next slide. So there's a table of contents, but it's really, there's like a 4-step process we're trying to take people through. And again, this is for the decision to integrate. We hope later on that there may be a implementation toolkit, but this is really kind of that early stage. And this came out of our discussions with working group members and others that were saying there really wasn't a lot of information about kind of how campaign integration does come to be and how it can be set up well in the beginning. So we talk about the step of identifying the problem, starting the conversation, exploring the possible campaign pairings, and the considerations at the global, nationals, and subnational level, and related to the interventions themselves that can inform this decision about whether to pursue or not integration. We know it shouldn't be done lightly, and it should be done thoughtfully and well in advance of campaign dates. So next slide. So just we kind of started to think a little bit more deeply about, how do you even start the conversation? What should you have with you? And this is for country and global stakeholders when they come together. So identifying the problem, understanding, what's the motivation or rationale behind potential integration, engaging leaders with the qualities and clout needed to generate interest on campaign integration, and identifying decision makers, ensuring equity as much as possible by also having a variety of stakeholders, including the community level's voice, and other steps for kind of setting up optimal conversations. And I'll turn it over to David to continue on with this matrix. David?
Yes, thank you. And again, it's really a pleasure to work with this group this past year and continuing on. And as Chris and Eva said, that I am with the Zainab representing IFRC-AMP on the coalition in this process. In order to go through this conversation about continuing or starting this on integration, in this case, it would be ITN with another intervention, we developed just a series of very simple worksheets really to help think through each process of this and all the considerations and criteria necessary to look at this. So we started with this, what we call a decision matrix, where you're very simply listing all of the key interventions that at least the coalition focuses on at this point, other than in malaria, which is ITNs and seasonal malaria chemoprevention, looking at polio and other vaccine preventable diseases, NTDs, and then vitamin A and assessment of severe malnutrition. And kind of looking across to say that if in fact for ITNs you want to explore, let's say integration with yellow fever vaccination, depending on the timing and the season and so forth, or measles and so forth, or if there's an MDA for lymphatic filariasis, you'd be able to go and start creating within each cell kind of a listing of what are the facilitators, what will work well in doing this combination of health campaigns, and what are the potential pitfalls, what are the barriers that would need to be addressed in order to make it happen. So next slide. In order to help put together those facilitators and those barriers, we looked at the data that we have at hand from the information, and we compiled a list of potential key criteria for these integration decisions. And starting with those that are based on the intervention that are across all of the levels of the health delivery system, things to be looking at in terms of the age range of the health intervention, seasonality, where the services will be delivered and how it's going to be delivered. The frequency, is this a one-up campaign? Does this happen every 2 or 3 years, like with ITNs? Those are kind of cross-cutting intervention type things to be deciding what's a facilitator and barrier. Then we looked at the evidence base that we have so far, and we created a list of global, national, and subnational or local considerations at each level. I won't go through all of these in detail, but as you can see with the global, we're talking about, are there global policies from WHO, from others that can inform the decision on integration? At the national level, are there some operational complexities, for example, that could be a barrier of working between ministries, between the malaria program and the program that's within the ministry that is operating neglected tropical diseases? Are there barriers, or does this exist hand in hand? At the local level, I think the CIWG, the working group, really wanted to focus on the place of the community in this decision making for integration, particularly on their capacity. Are there issues of incentive at the community or district level, really, for integrating? That would include monetary or non-monetary issues. Access issues. Are there the values for each one of these health interventions? Are they valued equally? And certainly the capacity to be able to monitor, as we see over here, post-campaign adverse events, if it's applicable in this case for immunization programs. So there you have sort of an array of criteria to help inform the pros and cons, the facilitators and barriers. Next one. And as you can see, very simply putting these things together, we gave just a few examples of what could be changed in the country context of what these facilitators and barriers could be. So starting with measles immunizations and ITNs, many of you were involved with some of these, a decade or more ago for providing measles immunizations and ITN distribution. So we listed a few facilitators about the timing, that the census and household registration data could be shared. The campaign intervals rather are approximately every 3 years if they are doing campaigns for MR. Geographic targets can overlap, but the barriers that would have to be addressed, including the incentives to coordinate the EPI and MCP programs, which in some places are not necessarily a barrier, they work hand in hand, or it could be a problem of turf, of coordination, and so forth. The cold chain versus the bulky nets, their transport and their warehousing, all are barriers or challenges that needed to be addressed. And the differences in target ages, with the ITNs targeting all ages versus measles 9 to 59 months. So you could see the idea of putting in each one of these cells, if you're going through the different potential interventions, this is what you would do for measles and ITNs. You could do the same for the other ones. We also gave an option for vitamin A and deworming programs if appropriate. Next slide. We then have a couple of worksheets to help through this process. First things first, if you take a look at all of the criteria, that all the considerations for integration, we would believe that there may be global guidelines and country and local context issues that need to be considered, either the guidelines exist or they would have to be developed in order to make these things happen. So government coordination mechanisms. What are the WHO guidelines on setting up a coordination mechanism at the global level in order to integrate ITNs with another intervention? Are there existing guidelines that allow this, or do they need to be developed? And at the district level, is there guidance that needs to be done on coordination? This would also be in terms of the timing, the funding sources, household registration. Are there existing guidelines that can be listed, and what are they to help through this process? Next slide. And then the next one is a very long appendix. This is actually taking a look at the very specific criteria, and we're setting out over here what we understand to be some of the latest global guidance from various sources on what is the guidance on these various considerations. So here we give on this page an example across health interventions of a campaign coverage objectives per WHO, and then the seasonality of the disease, what we understand from various sources of on the disease in various contexts. So you can see for malaria, we have the WHO guidance for coverage of ownership and use. We have similar things for SMC. And you can see across actually what this would mean for coverage, comparing coverage targets for polio, measles, vitamin A, and so forth. You could look at the seasonality patterns, which could actually influence the decision-making on integration between the various interventions. Going to the next page. Next slide. We give an example over here for the timing of the campaign and when this could, and so you could see right across all of these interventions, the recommended timing for implementing these campaigns and how this could influence your decision to integrate. The next slide. And I didn't show you the entire chart there in Annex B, but these are all of the considerations that we go through across all of the health interventions with the information that we have at hand right now of what can be considered. So you can go through in a methodical way of each of these to help make the decision and help understand what the facilitators and barriers are.